please explain and describe the key distinguishing features of more general or typically milder cases of attachment disorder in comparison to the less common reactive attachment disorder. So do you want to start with that, Roxanne?
Sure. What we see with children who have attachment issues, and understand that attachment is on a continuum. We have from mild to the most severe, and the severe is reactive attachment disorder. Now, in this question, it says less common reactive attachment disorder. We find that it's not as rare in the population of children who've been through the system in foster care or have had a lot of trauma in their background. It isn't as, you're right, it's not as common of a disorder. However, it's more common in those populations. So some of the features that we see are a high need for control, opposition behavior, a lack of bonding with the caretaker, pushing back, not allowing the caretaker or actually anybody in a significant relationship to get emotionally close, anger, anxiety, depression. We see a lot of lying, and that is a kind of a situation where kids do a lot of lying because they're controlling. So that's part of that control issue. Deb, you want to add to some of that?
Sure. The basis of the trauma creates the anxiety. And so the maladaptive behaviors that we see are coming out of that anxiety. So there's an extreme lack of trust, and that creates the need for control. Now, when you think about typically milder cases, there are many, many symptoms to be considered. And each of those symptoms could be scaled 1 to 10, and they would not all be the same number. So it is person specific when you look at the case and assess each case, and that needs to be kept in mind.
Well, and I have to say that these symptoms also overlap into other diagnoses.
Yes.
So you may have a child who has a lot of anxiety, but they don't have attachment issues, or their attachment issues are so mild, like maybe some insecure attachment or anxious attachment, where that shows up in some milder ways. And actually, a psychiatrist or a therapist or psychologist may miss actually the whole basis of why that has happened, and why the child has anxiety or has depression. So it doesn't necessarily mean that if a child has these symptoms that we're talking about, it is not necessarily that a child has reactive attachment disorder or even attachment issues, because they overlap like many disorders.
But we will readdress developmental trauma from reactive attachment disorder and give a thorough examination of that and what occurs. But today we're going to simply answer the questions that have been forwarded to us.